Hello, I'm Dr. Ellie Cannon and I'm going to talk today about how to treat a fever. Now, normal body temperature is actually 37 and we say that you have a fever if you have a temperature really above 37.5. The best way to check a temperature, both for an adult and for a child, is with an ear thermometer, which is the most accurate way of taking your temperature. And if it shows that you have a temperature above 37.5, that would really indicate a fever. Now, a really important message that I want to tell you is that actually you don't have to treat a fever. I always tell patients that you should actually treat the child, not the temperature. So if your child is running around and happy and is drinking and is okay, but you take their temperature because you think they appear to be hot and it is slightly high, there's no need actually to give them medicine. If, on the other hand, somebody has a temperature and they're not drinking and they're listless and they're not feeling well, then of course it's important to bring that temperature down. So what should you actually do when you've got a temperature? Well, the first thing you can do is to try and take some medicine to bring the temperature down. There's really three types of medicine that people use to bring down a temperature, and they are paracetamol, ibuprofen and aspirin. Now, for children, you can only use paracetamol and ibuprofen to bring down a temperature, and both of those are obviously available in liquid form for kids. I would start off with one of those medications that you're used to taking, either paracetamol or ibuprofen, and give it an hour or two to see if it's started to work. If it hasn't started to bring the temperature down and you're still hot, then you can actually safely take the two types of medication together, and that's absolutely fine to bring down your temperature with both medication. One of the crucial things to do when you have a fever, and particularly with children, it's really important to drink. Having a fever uses up loads and loads of your body's water and your body's natural fluid, and you sweat a lot and you can get dehydrated very quickly, and again, this is really important for kids. So you should try and drink at least twice what you would normally drink. Best to drink water, but if a child doesn't like drinking water, then they can drink juice or milk or whatever they want. And a good indication of knowing you're drinking enough, obviously, is that you're going to the loo to actually pass water, and then you know you're not getting dehydrated. Apart from medication, when you have a temperature, other things you can do for yourself are, first of all, it's important that you rest, because, as I've said, having a temperature actually uses up fluid in the body and also uses up energy, and if you're exerting yourself, you're going to start to feel more and more tired and more unwell. So resting is important. For children and adults, using cool flannels, not cold flannels and not ice packs, but using a cool flannel to dab the skin and to cool you down is also another good way to bring the temperature down. And it's also important to cool down the rooms that you're in. So don't sit with a fan directly on you, but have a fan in the room just cooling down the air in the room. If you have a temperature, if your child has a temperature and it's been going on for more than 2 to 3 days, and especially if there isn't an obvious reason why you have a temperature, then it's really important that you call your GP and seek medical advice. So the important message to remember is treat the person, not the fever. And if you are feeling unwell and you do want to bring down your temperature, as well as thinking about medicine, remember to drink, drink, drink. And that's how to reduce a fever.